Hi everyone, my name is Vinny. I'm a senior majoring in allied health sciences on the pre-med track.
Hello, I'm Adriana Sowell. I am a fifth-year senior at UConn, and I am associate medical science major on the pre-med track.
Hi everyone, my name is Princess Harmon and I'm a junior studying physiology and neurobiology pre-med track.
Hi, my name is Rachel Anderson. I'm a sophomore. My major is allied health and I'm on the pre-med track.
Hi everyone, my name is Tiffany Addy. I'm a sophomore and I'm a physiology and neurobiology major on the pre-med track.
Hi guys, my name is Amy. I'm a sophomore and a bio student and I'm on the pre-med track as well.
We're great. Okay, so today we are the Minority Association for Pre-Med Students, and we're here to talk about health disparities and really how it relates to Child Health Day and HuskyTHON in general.
Hello guys, so today we're going to discuss what are health disparities, what is health equity, and how it differs from health disparities. How the social determinants of health framework help us understand health inequity and health disparities. How children are impacted by health disparities, why it's important to pay attention to them, and how we can make an impact. So who are we? Minnie, do you want to take this slide?
So yeah, we're UConn MAPS, which really is just a club really to help minority undergraduate students who are interested in medicine, just because it is difficult in terms of finding opportunities and resources and things like that. So that's what we really are trying to do, just create that network for people so that they have opportunities looking into medical school. And just in general, health disparities in terms of how we work on them is, health disparities are attributed to the low number of minority health professionals in the field. So we really aim to change that through informational meetings regarding different topics, and then emotional and academic support, as well as mentorship on all levels. So we work with medical students, current residents as well, and also pipeline programs through UConn Health. So if you're interested in learning more, getting involved with MAPS, you can follow us at UConn MAPS chapter to learn more on Instagram and follow us on Facebook.
Yeah, and I think that we all can add to the fact that, like, at least for me, that MAPS has served as a way to navigate the pre-med space at UConn as a Black woman. It's very hard to find your place in this very stringent society where you have to there's so many things, so many different stressors that are kind of put upon you, and then the additional stressor of being Black women navigating these spaces where we're not necessarily always reflected. And our teachers and the people that are mentors and things like that has been a very positive group to be a part of, to help me be able to navigate these spaces in a helpful way. I don't know if anybody else wanted to add something about how they feel about MAPS. Okay. So the social determinants of health. The social determinants of health is a framework that helps to explain that our health is not only impacted by individual decisions, but it's placed in a larger framework where the social conditions that you are exposed to, so your education, your access to food, your access to community and social resources, social support systems that you have, your access to healthcare, and the type of healthcare that you receive because of different intersecting identities, your neighborhood, your ability to practice healthy activities such as exercising outside, or living in an area that is where a landfill is located and things like that. And then your economic stability, so your class and how that relates to your access to health and having a healthy lifestyle. So it explains that your social conditions shape the environment in which you live and impact your health and health outcomes. The impact of social determinants of health. a person's health is determined 80% by the social determinants, so social factors, and 20% by the healthcare that you receive. These differences in the social determinants of health led to differences in health, which are health disparities. These differences, the differences between groups is based on race, socioeconomic status, sexual orientation, gender, disability status, geographic location, among others. And the intersectionality of these different identities can work to worsen the health disparities of these different groups. And that's kind of like an idea of called syndemic. So you have the idea that your identity or how your health status and where you're situated in the world can impact the various health outcomes that you have. So an example of this is race, and if we're talking about child health, we talk race, developmental diagnosis of like autism and things like that, and being a child. So it's been reported that with developmental disabilities that Black children are like underreported disproportionately. This has to do with various factors or stereotypes with like Black children being seen as boisterous, or like the ways that they their disability is expressed is different than their white counterparts, and therefore is not seen as like the standard what is usually viewed as or used to determine if somebody has a disability or not.
Yeah, I can like go off of that a little bit. I think, a lot of these different things can lead to also just worsening social determinants of health in terms of like housing security. So I've, had the opportunity to volunteer at homeless shelters and things like that. And what you see is that a lot of people, when they are suffering from whether housing insecurity, food insecurity, they don't have the time or the resources to even look at their health or even pay attention to it. So for example, if you have a diabetic who doesn't have money to pay their rent, they're not going to be worried about, finding insulin and making sure that they have enough. So they might have to ration that. And then that just, again, worsens their health. If you think about like the intersection of race and gender identity, Black trans women are, often very just not seen. So you have them suffering from worsening health disparities, as well as, violence in general. So there's just a lot of different things regarding intersectionality, especially when it regards to children. So if you think about, Hispanic or Latinx children specifically, in the current political climate, it's hard for them to really focus on their health because they often are worried about their immigration status or really just a lot of different things regarding that. So it's really tough, especially when you're worried about so many different things. You don't know how you're gonna, eventually get through it. So I don't know if anyone else has anything to add.
I had one thing to add, and that was like the cost of like healthy foods versus unhealthy foods. One big factor of like one's health is what they're eating, and oftentimes like people that are in low socioeconomic like status, like they can't afford to get like everything organic and everything like that would be seen as healthy, and therefore they go for things that are cheaper, and the cheaper stuff is usually not as healthy in comparison.
Oh, and also I just realized one more thing that I wanted to add is like another thing that often really isn't discussed too much is environmental racism in terms of all this. So if you think about it, in low income communities, you're typically more likely to be exposed to a lot of different social and environmental hazards. So like pollution, whether that's water pollution, like for example, Flint, Michigan, who's still doesn't have clean water, or just like air pollution. So obviously like carbon emissions are a huge thing. Think about the California wildfires, like people that are suffering from homelessness already don't have places to live. So now you have fires that are literally just burning down everything. So there's just so many different things that really impact someone's health. And that's really what we're trying to get at today.
Definitely. So next we're going to talk about the difference between health disparities and health inequities. Health disparities are due... Did I skip slides? Yeah, I did. Okay. So the health disparities simply explain a difference in health. But health inequities go further by explaining that that these differences in health are avoidable. Health statuses and that the differences in health are avoidable because they're due to different social factors that are causing this because of how resources are distributed to different groups in a systematic and unjust way. Health disparities are due to health inequities because health inequities describe how various oppressions like racism, ableism, sexism, classism, and capitalism intersect to have force in people's lives and shape the environment in which people live and thus impacting their health outcomes. The ultimate goal is health equity, which is the belief that everyone will be given an equitable opportunity to achieve the highest attainable level of health, where health, as defined by the World Health Organization, is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This requires removing all and any barriers to health at their root causes. To sum it all up, health equity is not just providing everybody with an equal chance, but providing everybody with an equitable chance to access and receive what they need to achieve a fully healthy lifestyle. So it's removing all barriers, as shown by this infographic. So, did anybody want to talk about that?
Yeah, I can go ahead. So yeah, this is like a pretty common infographic. I've seen it multiple times, but I think it hopefully really paints a picture in terms of, liberation is kind of the idea of health equity in the sense that, it requires justice in a sense. If you think about, health as a human right, that is something that is often denied to a lot of people because of these different structural barriers. So if you think about racism, obviously that's very rampant everywhere. So that's something that impacts people's health, not only in terms of being able to access health in the hospitals, but like the quality of healthcare you receive often is deteriorated because of, the color of your skin. So it's in terms of, really like educating yourself, but also, being aware of that. And in terms of HuskyTHON, that's something that I really like in terms of, raising money to help with different issues that are being faced by a number of different child patients. And these things start from when you're a child, so they impact you for the rest of your life. So I mean, I figure, a personal example is probably helpful. I grew up in a very low income community with very minimal food access, or minimal healthy food access. And that, kind of shapes your relationship with food over time. But also education level, there wasn't really a lot of education opportunities where I was living. So my parents specifically put us in a different town so that we could have a better educational opportunity. But, that shouldn't be the case for children everywhere. So that's, just I figure that would sum up some things and really kind of paint a picture in terms of, health equity and health inequities and how they can really shape people's lives. I don't know if anyone else had anything to add.
I think also to add to that, like an example I use a lot is the idea of thinking about like childhood asthma and how the doctors typically, like when you go with biomedicine, issues or health issues that or health outcomes that you're having are typically treated in a very like stringent biomedical way, where they only think about how it's like biologically treating you, so they'll prescribe you medicine and different things like that. But it doesn't look at the greater experience of like how their social factors, the environment which they're situated in, can impact their health. So, can you guys hear that? Okay. Oh my gosh.
Oh. am I laughing? Oh.
Okay. So to sum it all up, the idea that or for health and oh gosh, okay. I don't know where I'm going. So to sum it all up, we use this infographic that depicts the difference between health equality, health inequity, the reality that we live in today, and what liberation will look like. Liberation will look like taking out any barriers into the access of health and to eradicate all oppressive systems. A way that you could look at this is through the idea of like a child that has persistent asthma and goes into the doctor, and the doctor only chooses to look at the biological problems that are causing the asthma and prescribing the medicine instead of looking at the social conditions that they are situated in and how that can be affecting their asthma. For example, if they live in an apartment building that has mold and the landlord is not doing anything to fix the mold, looking into a lot health partnership to help address those problems to get the mold out of their building so they can have clean air to breathe, or looking at the fact that they live in an area that has a landfill nearby and the toxins and pollutants that are being propagated by the landfill, and how trying to address that problem of the landfill being there in relation to the child's asthma, or looking at if there's a bus stop that is in front of the child where the child lives or near where the child lives, always permitting fumes, diesel fumes, how that could be affecting the child's health, or looking at the parents' socioeconomic status and seeing how they're not able to buy the healthy food they need, or they live in a food desert and they don't have access to clean food or healthy food to eat, and how that could be affecting the child's asthma. So looking at the child's situation in holistically and in its totality will help to continue to address how health inequity is affecting biopic people, the disabled people, across gender, socioeconomic status, and the list goes on. So the idea is that we remove all these different barriers that could be affecting the child's health, not only biologically, but socially, so that it enables everybody to be able to live a healthy life. So how do health inequity intersects with health disparities? Health inequities demonstrate a health injustices caused by systems that structurally violate marginalized and vulnerable populations. So how does HuskyTHON play a role, and what should they do? So one way that HuskyTHON can work to fight health equity is by amplifying and collaborating with organizations within the community that are already doing health equity work, like Health Equity Solutions, that is located in CT, which goal is to eradicate health inequities in the area. I don't know if any other panel members wanted to add to both this slide or the last.
I recently learned a lot more about HuskyTHON in general, and knowing that, HuskyTHON, the money that is raised goes to the Greatest Need Fund. So I think that is already in itself a really great thing, because, a big thing about health disparities is the lack of resources. So providing funding for different treatments and things like that. But another thing is that, Connecticut is one of the states in the country that has the worst health disparities. It's life expectancy changes depending on how long you drive within like not only Hartford but New Haven, like other like low income versus high income areas like that. So another thing is really just like analyzing, where that money is going to and if it's going to like the most marginalized populations. But HuskyTHON is doing great work, and I'm proud to be promoting that and talking about that with you all today. I don't know if anyone else has stuff to add before we move into some questions that we got.
I also think that our voices go a very long way, more than we think or expect them to. So even just continuing conversations this within our own communities can go a very long way in creating differences within our and for children.
another thing I wanted to add is, like Princess said, starting those conversations, even if you don't really know a lot about it, mentioning things like that in terms of like structural racism, health disparities, especially to like pre-health students, because I know a lot of pre-health students are involved in HuskyTHON, but even outside of that, really just like in your circle, raising awareness about it. And yeah, I think just like educating yourself. There's a lot of different podcasts and books and articles that you can read, especially now with the COVID-19 pandemic, kind of unveiling a lot of the structural inequities that exist. I think as a pre-health student, if you're looking to go into that field, that is something that really does impact patients a lot. So it's really important to be aware of that and have that understanding of it going in, that there's not just healthcare that impacts patients, but also those social determinants of health. Anyone else have anything to add? Okay, so the questions that we got were, well, we kind of already answered this, but I don't know if anyone else has stuff to expand on. How do food deserts and housing inequities affect healthcare disparities? I don't know if anyone has anything to add, but I can talk a little bit about it.
I think food deserts affect and housing inequity affect health disparities because, like, as we were talking about earlier, it creates like health inequities within the community. So if people don't have access to clean food and they have to drive miles to get it, they're more likely to eat the food that is closest to them, which is disproportionately going to be like fast food or processed food or food that is not necessarily clean or healthy, food that is like loaded with antibiotics. And that's because of their circumstance, not because of their choice, right? It's like a constrained choice. You don't, like, you have the choice to get clean food, but if you have to drive like over 5-10 miles, like 15-20 miles just to get to the nearest grocery store, it's very unlikely that you're going to like access that food. And as far as like housing inequity goes, like where you live is like is probably the greatest indicator of your health and how that's going to be bore out, because where you live dictates what is you have in your community, what resources you have and resources you don't have in your community. So if you live in a community that is low income or disproportionately minority, more times than not, you're going to be exposed to a lot of different stressors, different toxins that you wouldn't be exposed to if you didn't live in that area. So I think both of those things combined could intersect to create like a deterioration of health and like a weathering of your health over time. That's not good. So
I highly recommend looking up like the mapping life expectancy tool, because that is something that really like opens people's eyes mostly. Because like it's something as simple as like changing a single number in a zip code to something else that will like change the amount of years that you're expected to live. So that is something that always really like opened my eyes, and I think that would be beneficial in terms of like understanding more about how where you live affects your health. And in terms of food deserts, yeah, I totally agree. They obviously are not good. But I think another thing is like food swamps. It's not really talked about a lot, and that's like a lot of like a high density of fast food like locations in one area. So that is something that also really impacts like obesity outcomes and like diabetes outcomes in low income populations. Because if you think about it, like if you have to choose between healthy food that's more expensive or fast food that's cheaper, whatever is going to feed your family the most, like you're going to get. So that's something that really is important to consider, especially obviously low income populations and things like that. But yeah, and that's also like on a policy level. So in terms of policies, make sure that you're voting for the people that are paying attention to these issues, because that's really where things get changed. Taking a class right now, and it's really exposing to a lot of these things. So, we have to make sure we're voting for the right people. So, and if anyone has anything to add, we can go into the next question, which is very similar. So it's, how is the government addressing this, and how has the approach changed in recent years, would you say? So very fitting, I would say.
current times, I know recently I went to a Black Lives Matter protest over the summertime, and one of my local senator, Senator Anwar, he's a senator, CT legislator at the CT legislature, but he also is a emergency doctor, and he spoke to the fact of how racism should be acknowledged as a public health crisis, and how the ways in which like racism manifests itself in society and boards itself in like disproportionate health outcomes that negatively affect the BIPOC community, specifically the Black community, should be recognized. So like electing people into positions that like understand and are seeking ways to make changes with health inequities, I think is really important, and ways that government can activate these different kind of motivations is acknowledging racism as like a public health issue, because that frees up resources and monies to actually address the issue. So I think that would be like an important step for government and policy to intersect with health justice and health inequities and equity.
I've been reading a lot lately that there is like a government responsibility in terms of like addressing these issues, and I think we could all agree that there is a lack of accountability and responsibility in our government right now. So I think that approach has definitely changed in recent years, but I think it's always just not been good in general. So it's more of like a very systemic thing that has to occur, and right now the system is just currently not going to do that. But we are in the up and coming generation, so we have a lot more power than we think, like Princess said, and our voice really does matter. So I think one, understanding more about this, like this is a great first step, so you're in the right place. But just like in general, just continue educating yourself, educating others around you, and just share what you know, because it goes a long way. But yeah. I don't know if anyone has any last minute things to add or no. Well, thank you all for coming, or whoever's watching this, and we hope you learned something, and just continue to, like I said, educate others, educate yourself, and one day we can work towards a world where we all have the correct right to health that we all deserve. Yeah, thanks. And have a great day. You can stop recording now. Sorry.